This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today, we're looking at a fascinating new study from the journal Clinical Oncology, scheduled for the 2026 volume. It's titled Efficacy and Safety Outcomes of Stereotactic Radiotherapy with Cyberknife System in Brain Metastases Patients Treated with Immunotherapy or Targeted Therapy.
This is a timely piece, Alara. As we both know in the clinic, brain metastases, or BMs, represent the most common intracranial tumors in adults with advanced solid cancers. They significantly impact both morbidity and mortality. For years, our focus was purely on local control through surgery or whole brain radiation, but the landscape has shifted.
It really has. We've seen the emergence of systemic therapies like immunotherapy, which we'll call IT, and targeted therapy, or TT. These have objectively improved survival outcomes for patients who previously had very poor prognoses. However, the interaction of these systemic modalities with stereotactic radiotherapy and radiosurgery, SRS and SRT, remains, as the authors put it, poorly explored.
That's the black box we're dealing with. When we use the Cyberknife system to deliver high-dose radiation, we're often doing so while the patient is still on these potent systemic agents. The study's primary aim was to evaluate the safety, local control, and overall efficacy of this specific combination.
Exactly. One of the key aspects the study highlights is the efficacy side, specifically local control, or LC. In the context of Cyberknife, which allows for such high precision, the question is whether IT or TT acts as a radiosensitizer to improve LC, or if the systemic control they provide simply changes the natural history of the intracranial disease.
And from a neurosurgical perspective, safety is our first priority. We're always looking for signs of increased toxicity. When you combine the inflammatory response triggered by immunotherapy with the focal radiation from a cyberknife, there's a theoretical concern about increased rates of radionecrosis or peritumoral edema.
Right, and that's why this paper is so vital for the residents and practicing surgeons listening. The study dives into these safety outcomes to see if the combination therapy is tolerable. Given that Cyberknife is often used for multi-session SRT as well as single-fraction SRS, the interplay with the timing of IT and TT doses becomes a critical variable.
It's interesting because the paper addresses the fact that while systemic therapies have improved survival, the brain remains a frequent site of relapse. If we can safely combine these treatments, we aren't just treating the lesion, we're potentially changing the systemic environment of the patient.
And for our listeners who are medical students or early residents, it's important to remember why this specific technology was used. The Cyberknife system's ability to track and deliver precise doses is the backbone here. The study looks at how this precision balances out the systemic effects of IT and TT.
So the takeaway for our colleagues in the OR and the clinic, we are looking at a paradigm shift where the local treatment of brain metastases is no longer isolated from the systemic management. The efficacy of combining these tools appears to be a major step forward in managing the common intracranial tumors that define so much of our oncology workload.
It certainly seems that way. The study reinforces that while these interactions were previously poorly explored, we are now gaining the data needed to safely integrate Cyberknife SRS with modern immunotherapy and targeted agents.
Well, that's a great overview of a very important study. Thank you for diving into the data with me, Alara.
My pleasure, Dr. Aris.
And thank you to our listeners. Stay tuned for our next episode where we continue to bridge the gap between neurosurgical research and clinical practice. Keep learning, and we'll see you next time.